DHEC says it supports the CDC's approval for Pfizer's vaccine shots for children ages 5 to 11. The agency says they are excited to work with vaccine providers to ensure access throughout the state. Parents can start getting children of this age group vaccinated today. DHEC Director Dr. Edward Simmer said this approval was a major step forward for South Carolina and the nation's fight against COVID. Meanwhile, MUSC has officially rolled out a plan to start administering their 3,900 pediatric doses of the Pfizer shot to kids ages 5 to 11 as soon as tomorrow. Our Amy Russo tells us how our Low-Country hospitals plan on getting the shot to as many kids as possible and why it could not have come at a better time.
The vaccine is the exact same as adults, but a lower dosage.
The main reason that people are hesitant to get this vaccine is that they think that the process was rushed or that we are still learning about this vaccine.
While Dr. Allison Eckert says that may be true, it's critical to get your child vaccinated.
We have seen a huge spike in hospitalizations and cases. It is more likely for children to die of COVID than it is to die in a car crash.
MUSC has rolled out a plan to get the younger children vaccinated in several areas throughout the Low-Country.
And we've already had a number of parents sign up to get their children vaccinated, which is really exciting.
This coming at a critical time with the holidays right around the corner. Officials expect there to be another COVID surge in December and January.
I strongly encourage people not to wait. We are expecting a holiday surge to the same extent that we did this fall.
I asked our Low-Country school districts if they plan on partnering with local hospitals to get children vaccinated. Charleston County School District officials, they tell me they are partnering with MUSC, and that's going to begin the week of November 15th. Dorchester District 2 officials say they have a template plan in place. Right now, it needs to be tailored to students and depends on what health service care provider administers the vaccine. Berkeley County School District leaders tell me they have not yet received guidance from state health officials or the Department of Education, but they will work with medical partners to determine plans for offering vaccinations to qualifying children.
Kids are not spared, and it's not just COVID, it's the aftermath of COVID as well that we really are seeing in the pediatric population.
Trident officials tell me they are finalizing a plan to get the vaccine to that new age group, and that plan it is expected to be released this Friday.
Labor Secretary Marty Walsh visited the Wando Welch terminal today. He was invited by the Longshoremen's Association. Recently, there's been some problems with ILA workers and the ports. Our Tara Jabor was at that meeting. She tells us what was discussed.
Charleston ILA workers say they want to grow proportionally with the South Carolina ports, but right now they feel like they can't do that.
We are the dock workers here in Charleston ILA. We've been in this port, believe it or not, since 1867. The generations of longshoremen here. We care about this port. We care about this industry.
Hundreds of ILA workers met with Labor Secretary Marty Walsh at Wando Welch Terminal.
They kept the essential items coming into our country, and I want to thank them for the work.
The local ILA says they want more deep sea craft work like crane operation at South Carolina ports.
All other ports, pretty much except for North Carolina, South Carolina, and Georgia, our folks are doing all those jobs. So as we grow forward into the future together, we want our jobs. We want the jobs that belong to us under a master contract.
The South Carolina Ports Authority filed a complaint with the Attorney General's office against the ILA and the U.S. Maritime Alliance. In mid-September, a judge ruled against the ILA. We reached out to the Attorney General's office. AG Alan Wilson said in part, quote, South Carolina has been a staunch right-to-work state, and the union cannot undermine our laws guaranteeing their right to work. These laws do not permit the union to take over jobs from state employees, end quote. Riley says South Carolina is a right-to-work state, but
you have a right not to be union. I have a right to be union, and neither one of us should have to be harassed or pursued based on our choices. But if I decide to be union, I have the hounds of hell on my trail, starting with the state legislature and all the way down to the port.
He says City Council holds a lot of responsibility for this move because of what he calls the lack of action council members have taken in recent years to stop a decades-old problem. He tells me this decision from Roper should be a wake-up call for city leaders.
The story of Roper moving is a story about the challenges that we have with infrastructure when it comes to managing water on the peninsula of Charleston.
Roper on the move. The hospital system announced on Wednesday it would be working to make life easier for patients, partly by moving their hospital away from the Charleston Peninsula. Councilman Mike Seekings, who represents the area, believes the move has to do with floodwaters in the medical district.
A healthcare facility that's been here for centuries moving, and the principal reason they're moving is a reason that didn't exist 100 years ago or 50 years ago or 25 years ago. But we've known about it coming, and we've just, I think, been slow off the mark to address it. This is the wake-up call. Now is the time. We have to move. We have to manage water, and we can't wait another day.
A wake-up call that Seeking says will hurt the livability of downtown.
It's something you have to think about in terms of quality of life and access to health care, which is something that we all want.
I reached out to Roper St. Francis to ask just how much of a factor flooding was in the move, and while they say it was not the driving factor, Seeking says the fact it was even considered should push council into action.
As specific as the project that takes care of the western side of the peninsula, the 850 acres of the western side, which is the Calhoun West project.
The Calhoun West project would add a tunnel system and pump station to the western side of the peninsula to manage that flooding. It's still in a preliminary stage. I asked Councilman Seekings how confident he is this project will get done.
You're only one member of this council that can make this change. How confident are you that the council will come together and get the job done?
I don't think there's any question that we as a council can come together and put together a list of priorities when it comes to water management and then start moving towards funding. We need the cooperation of all people involved, from the mayor's office across council. We should have done it before